In obsessive compulsive disorder, a person has unwanted or obsessive thoughts that get stuck in their head. What is obsessive compulsive disorder, or OCD? Answers from aboutkidshealth.ca at the Hospital for Sick Children. Obsessive and compulsive thoughts lead people to perform repetitive or compulsive behaviors or rituals to help them feel less distressed. OCD can affect anyone from any background. Most people with OCD have both obsessive thoughts and compulsive behaviors, but it is possible to experience an obsession or a compulsion on its own. OCD is a complex disorder that can impact a person's quality of life. Although many people with OCD are aware that their thoughts and behaviors don't make sense, they have difficulty stopping or resisting them. Some common obsessive symptoms of OCD you may have include fears of germs or illness. You may have repeated thoughts that objects around you, inside or outside your home, are dirty or contaminated with germs. Intrusive thoughts or fears. You may have a thought or image of something bad happening to someone or to yourself. You then worry that because you had the thought, it will in fact become true. A need for symmetry and order. You may need things to be placed in a certain way, such as organized by color or size, in order to feel at ease, or need things to be excessively neat and tidy. You may also be excessively interested in numeric patterns. Excessive doubt. You may doubt that the door is locked, the oven is turned off, or the alarm clock is set. Some common compulsive behaviors of OCD in teens include prolonged and repeated washing. You may feel a need to wash yourself repeatedly, wash laundry more often than needed, or insist on cleaning the bathroom or kitchen a certain way. You may have red, dry, or cracked hands from repeated washing or skin picking. Repeated checking or counting. You may repeatedly check if the door is locked or oven is off. You may need to do things a certain or special number of times in order for it to feel right. Needing routines or rituals. You may need rituals such as performing actions in a rigid order, repeating phrases or numbers in your head, or arranging items in certain ways in order to calm your anxiety. Doing more than what is expected. You may clean things more thoroughly or more often than needed, spend too much time getting dressed or eating a meal, or asking repeated questions that may not seem to make sense. Anyone with signs or symptoms of OCD should have an assessment by a healthcare professional. An early and proper diagnosis leads to effective treatment and an improved quality of life. For more information about obsessive compulsive disorder and other health topics, visit teens.aboutkidshealth.ca.